Good afternoon and welcome to this week's National Bleeding Disorders Foundation's Wednesday webinar. My name is Naomi Miller, Programs and Partnership Specialist on the research team, and I'm today's host. The title of today's webinar is How Hurricane Helene Affected Our Bleeding Disorder Patient. This webinar is being recorded. The recording will be available shortly after it ends at the NBDF website at bleeding.org. Today, we are joined by Joetta Smith, registered nurse and doctor of nursing practice. Joetta Smith began her career more than 20 years ago. She attended the Medical College of Georgia and obtained her Bachelor's of Science in Nursing. She started out as a pediatric oncology nurse at the Medical College of Georgia. As a registered nurse, she continued to strive for more knowledge within the field of pediatric nursing. She is a nationally certified pediatric nurse and a certified pediatric oncology nurse. Joetta loves gaining knowledge and advancing in her career. In 2013, Joetta obtained her master's in nursing education, and in 2019, she earned a Doctor of Nursing practice degree, all from Augusta University. Her doctoral thesis focused on creating a transition manual for educating youth with hemophilia. We are also joined by Merika Hawes, Master's in Social Work and a licensed social worker. Merika Hawes is the hemophilia social worker at the Augusta University Pediatric Hemophilia Treatment Center at the Children's Hospital of Georgia in Augusta, Georgia. Merika has worked with children, adolescents, and families with both bleeding and clotting disorders since 2021. Merika received her Master's of Social Work degree from the University of South Carolina in Columbia, South Carolina. She has over 10 years of direct experience as a social worker with specific training in bleeding disorders, suicide prevention, and crisis management. Merika has been part of NAMI since 2015. Lastly, we are joined by our lived experience expert, Chase Williamson. We encourage you to ask any questions you may have today. You can ask your questions by using the Zoom Q&A feature at the bottom of your screen, and you can put your questions there at any time during the webinar. Following our speakers' presentations, we will give your questions to them. In this session, we will discuss the impact of Hurricane Helene on the bleeding disorder community. Helene made landfall in the Augusta, Georgia area in the early morning hours of Friday, September 27, 2024. With wind gusts up to 80 miles per hour, the hurricane destroyed several homes and businesses, killed more than 25 people, created shortages of food, fuel, and ice, and caused loss of power and water to more than 200,000 residents. During natural disasters, children with chronic health conditions may experience added stress due to interruptions in treatment, exposure to environmental triggers, damage of medical supplies, and challenges with accessing medications and medical equipment. Today, we will also hear from our lived experience expert to share their experience. Ms. Smith, please take it from here.
Good afternoon. Greetings from Augusta, Georgia. We are a small pediatric HTC here in Augusta, Georgia. Our medical director is Dr. Afshin Ameri. He is not only a treater for hemophilia patients, but he is also board certified in oncology, sickle cell, and benign hematology. We do not have any disclosures. So, what were the effects on the Augusta area? 29 lives reported lost due to the direct or indirect impact of Hurricane Helene. Multiple children died as a result of Hurricane Helene, including twin babies in Georgia, a family of 3 in North Carolina, a 7-year-old girl and a 4-year-old boy died when a giant oak tree landed on their bedroom floor in Sandersville, Georgia. 2 twin babies and a mother from Thompson, Georgia, also died. So more than 200,000 residents were without power during this episode. There were boiling water advisor for at least a month after the storm. There was also a countywide curfew from 7 p.m. to 7 a.m. due to it not being a safe for traffic lights being torn down by the storm. Governor Kemp at that time presented a executive order for that area. This made it difficult when the traffic lights was down because it made it unsafe for driving because of lack of clear traffic guidance. The people during this time also had a shortage of food, ice, and gas, like we've already heard, which caused nutritional needs for many of the people in the CSRA. Many people were without gas on the highway. They gave out of gas as well. So our leadership team here at Wellstar noted that this was an issue for the people coming in, the staff members coming in to work. So with that in mind, they regulated and asked that the county would bring in gas for the employees who were coming in who was coming in to work so that they could have gas to get in for work. So how our hospital responded during this episode with Hurricane Helene. Wellstar employees was without power and remained operational on emergency power generators. They began to cancel all of the outpatient clinic visits and procedures. They continued only with emergency surgeries and emergency visit. During that time, the oncology patients and the hemophilia patients who had increased needs, they were transitioned over into the emergency room so that they can continue the care of those patients. Complicated emergency patients were transferred outside of the hospital. So, how did the hemophilia clinic help out in this episode during the disaster? Hospitals sent out automated phone calls to all of the patients, notifying them of the closure. Our staff, medical staff, had to become very flexible during this time. Dr. Mary was a lifesaver for many of the patients and the medical staff during this time also. Although he was affected by the hurricane, by the damage to his home, many of the physicians didn't have that privilege. Roads was closed. Many trees had fallen on their homes. So Dr. Mary volunteered to take on that responsibility and come in and take care of not only the hemophilia patients, but the oncology patients as well. And during this time, as a nurse manager, I came in as well and triaged all of our hemophilia patients. Now, there was two patients that came to mind during this disaster. We have a very fragile, well, two fragile little boys who has to have a strict regimen of factor product, and then also they have a Broviac dressing, a Broviac line, central line. So that meant that the Broviac dressing changes had to take place. So that particular procedure usually take place in the clinic. So we had to get these patients taken care of. So in turn, this is when we reached out to our outreach nurse, which is a hemophilia of Georgia outreach nurse. So how did Hemophilia of Georgia responded to us? I would like to keep in mind that this particular episode helped us to bring in synergy with the hemophilia of Georgia. The outreach nurse found out that we was having this issue. So the synergy in the interaction and cooperation of two, this is what synergy means to us. Synergy is the interaction and cooperation of two or more organizations to produce a combined effect greater than the sum of their separate effects. So due to the power outage and internet outage, our news reporters were not able to communicate about the aftermath of the hurricane. And that's what made it so devastating to all of us here in the CSRA. So, as a result, there were at least 3 days after the storm that we didn't have any power, we didn't have any internet services. Some of our family members, our governor, Governor Kemp, and even our president of the United States, and Hemophilia Georgia didn't even have a clear understanding of the mass destruction that Hurricane Helene had brought to our city. So, with this in mind, I phoned the Augusta outreach nurse from Hemophilia Georgia to inform her that to inform her of our needs for our hemophilia disorder patients. Immediately, she informed her leadership team there at Hemophilia Georgia about our needs, and they started the process of meeting the needs of our patients. The synergy process of HOG and our treatment center began with the HOG outreach nurse, and we are so proud of that. She went to the homes of our patients and performed all of the necessary nursing duties. Like I mentioned before, these patients are on a rigid schedule with factor and their Broviac dressing changes that had to be changed on a weekly basis. Two of our patients, one gets factor products on a daily basis. One gets factor product 3 times a week, and then on a daily basis as well. So, and then with this synergy process, Hemophilia Georgia pharmacy and accounts payers team came into fruition for us as well. The director of the pharmacy at HOG phoned us to ask of our needs. They were all to communicate with the insurance companies and inform them of each patient's needs. After this process, some of the pharmacy team communicated back to us and back to the families about dispensing the factor product that they lost during this outage because of no refrigeration. So, how does the impact of bleeding disorder? How did it impact the patients? With hemophilia A patients and hemophilia B patients, due to long-acting products such as Hemlibra and Novo 8, there were no increase in bleeds. Some products can be kept at room temperature for up to a week. Hemophilia Georgia was able to provide both nursing and pharmacy services to us during that time. And I want to go back to the products that we can keep at room temperature. So we have Hemlibra. The vials should be refrigerated, but it can be outside of the refrigerator for up to 7 days. Nova 8, it can be room temperature for up to 3 months with a temperature no greater than 140 degrees. So, with this, most of our patients had been taught a long time ago that before these particular products came out, that we should always keep factor products in the refrigerator. So, not only were the parents uncomfortable with this information, our team was uncomfortable with the storage process as well. Plus, temperature actually reached 104 or more during this time of the aftermath. Therefore, it was great for the hemophilia pharmacy to come step in and start the process of getting factor redispensed to our patients. So the education that we provided to our patients, we provided to them how to safely store hemophilia products during a power outage. We also taught them who to contact during the hemophilia emergencies. And they know that, but then we also know that during a panic situation, sometimes they don't have um, the idea of who to contact during these situations. What else did we teach our patients? How to develop an escape plan, and then how to prepare emergency supply kits with emergency diagnosis cards in the bag, which of hemophilia meds, non-perishable items, water, flashlights, and so forth. So during my nursing triage process, I informed all of the patients to keep their products in the refrigerator as much as they can with the door closed. And as the refrigerator can usually maintain safe temperature for about 4 hours without power. If there were ice packs in the fridge, we asked them to use those ice packs in from the freezer, or if you have an ice maker, to put that ice on top of the um, products. Another trick that I learned during this episode is that if I had, I do have an ice maker. So what I did, and I in turn gave this information to our patients, that if you have an ice maker, you fill gallon bags with that ice, and then you put that over the factor any of their medications. Who to contact during emergencies during hemophilia disaster. We also provided that, and I know I'm reiterating that, but that was a strong reiteration for our patients during that time because of the panic mode. And that's the end of my presentation. We're going to go ahead and transition to our social worker, Merika.
So our hematology clinic began full operations a week following Hurricane Helene, when the CSRA began to return to a new normal. After returning to our clinic, we began to have an influx of bleeding disorder patients and their families who began requesting assistance for a few different things, including replacing hemophilia medications, guidance on what to do with spoiled medications, financial assistance, or assistance with completing some FEMA applications. As a result, our hemophilia team determined that we should find a better way to help our patients. We created a survey with 3 goals: to determine how the patients and their households were impacted by the storm, to help our patients and their families prepare for future natural disasters or emergency situations, including who to call, how to store medications, and also we wanted to develop a plan within our hemophilia clinic to reach out to our patients in the event of a natural disaster or emergency. So who we surveyed, this is just over a course of a week. We began with a small population size based on the patients who called our clinic the week following the storm and requested assistance. We surveyed a total of 10 households. 7 of those households were asked via phone, and 3 were during rescheduled clinic visits. Criteria for the survey included households who had at least one child who was diagnosed with a bleeding disorder, had a clinic visit rescheduled because of the storm, and who requested some type of medication or financial assistance because of the storm. The average household size was 4.3, 50% identified as Black, 40% identified as white, and 10% identified as Hispanic. And out of this group, 100% were hemophilia patients or their households. So we asked the short 7-question survey. We interviewed these verbally. We asked them how the storm impacted their household. Was their household without power? And if so, for how long? Any financial effects, missed pay from work, insurance deductibles, or other insurance expenses? Did they make any prior preparations for the storm? And if they did, or if they did not, how would they have handled the storm differently the next time? What was their bigger stressor their household experienced because of the storm? Did their children lose any hemophilia medications? And did they miss any hemophilia clinic visits because of the storm? So some common statements from the survey included several families were displaced due to damage to their home or not having power. Some households went to stay with family, some went to hotels. Due to lack of power, some households were unable to keep refrigerated medication, causing several medications to go unusable. Many families were not prepared for the natural disaster and wish they would have took more time gathering non-perishable food items, generators, bottled water, or wish they would have put gas in their car before the storm. Several families lost wages due to jobs being closed and a lack of childcare and schools being closed. Having to pay expensive deductibles for damages of houses are things that are not covered under insurance. So this is another chart. Out of the 10 people we surveyed, 9 requested some assistance, including medication refills, medication damaged by the storm, lack of work, and needing financial assistance, are having to replace missed food items due to the storm. 3 people were replaced from homes. 2 people stayed with relatives. 1 family was able to get a hotel room. The remaining 7 family members either did not have damage to their homes, had nowhere to go, or felt comfortable staying in their homes with the damage. 5 of these homes had to replace hemophilia medication due to lack of power. The remaining 5 homes either were not prescribed refrigerated generated medications, used a generator, or stayed in a hotel. 9 were without power, and the remaining 1 home lives outside the CSRA area. 5 had damage to their home, and the remaining 5 either lived in an apartment or did not have any damage to their home. So these are a list of some resources that we received. Hemophilia Georgia was amazing with making sure our patients were able to get medication redispensed. A lot of the pharmacies like HOG and CVS were able to redispense within the same week following the storm. The city of Augusta also provided free shelters to people who were displaced during the storm, and they provided hot meals, cases of water, and other non-perishable food items. And also, if you needed clothing, they were able to give that out too. Hemophilia Georgia was able to provide additional food assistance and also hurricane relief. The Federal Emergency Management System, FEMA, set up substations throughout the CSRA and were able to provide reimbursement for hotels, generators, and other storm-related damages. The National Bleeding Disorder Foundation website also offered various resources to help our bleeding disorder patients. Okay. So we're gonna let Chase, our family member, give a little testimony.
Oh, shoot.
While we wait for Chase, I'll talk a little bit about our emergency preparedness. Oh, you ready now? Go ahead.
Yeah. So, hello, my name is Chase Williamson. I'm a firefighter paramedic. I'm the father of 2 children, 1 5-year-old boy who was diagnosed with severe hemophilia B when he was born, and a 22-month-old girl who was also diagnosed with hemophilia B, but she's mild. He is one of the patients who gets factor very regularly. He gets Nova 7 3 times a day, as well as his factor 9 Prophy Rebanon every 3 times a week. So Hurricane Helene affected our household. We did have damage to our home. We lost power. We were displaced for about 2 weeks. But we're lucky that we have family close by. We were able to stay with them. He did not lose any of his actual medication itself, but the box, it stayed cold, like Joetta said, for about 4 hours before the boxes started to become wet. So we had to break down every single box, take out all the supplies that were in that box, and just put those supplies in individual bags inside the refrigerator. So that made it kind of hard to keep track of and keep up with. It made it also hard for us to be able to order any more factor through Hemophilia of Georgia due to the fact that they couldn't get any factor to us. But Joetta was a lifesaver. She was in contact with us the whole time. She was able to get us some of the stuff that we need. He's also one of the patients who has a Broviac line who requires a dressing change every week on a Thursday. Luckily, we had just ordered everything he needed to change his dressing for about 2 weeks. So that was fine. We like I said, we were back in our home within about 2 weeks, power back. There was still some slight damage to the home. So like I said, we didn't lose any factor at that point. Like I said, we were able to keep in contact with the clinic through Joetta. Dr. Miri was also a great help. And then Hemophilia of Georgia with Nurse Karen was also a great help. Like we were able to stay in contact with just about everybody. It was kind of hard for about the first 3 days. We didn't have any cell phone service, no power, nothing like that. So it was kind of hard. Like I said, Joetta's a lifesaver. She literally lives probably 10, 15 minutes from us. So we were able to stay in contact with her that way. But other than that, like I don't think we had it as bad as others. So we were lucky. Like I said, we were displaced for about 2 weeks. We did lose power, but we didn't lose any actual medications. He never got hurt. So that was a lifesaver. We were extremely cautious in that 2 week time period because if he did, there was no way for us to really help him because we couldn't get to the hospital. That was the biggest problem is the roads were shut down. There was no way in or out of where we were at. But like I said, we were extremely lucky compared to most.
Thank you.
Thank you so much for sharing. And if that was the last slide, or if you all have more slides.
We have one more. I wanted to tell everybody about the grant.
Wonderful.
Okay, so our HTC was awarded the Social Work Fellowship Grant through the National Bleeding Disorder Foundation from 2025, 2026. And we decided that, well, we applied for an emergency preparedness for our bleeding disorder patients. We realized that, of course, during natural disasters, children with chronic illnesses may experience added stress due to interruptions in treatment, exposure to emotional triggers, damage to medical supplies, and challenges with excessive medications or medical equipment. This was the first time that Augusta experienced something in this decade. So we wanted to make sure that our bleeding disorder patients and their families were equipped for the next storm or if we had another storm. So just some goals of our grant. We wanted to increase bleeding disorder patients' abilities to prepare for natural disasters. We want to decrease PTSD and anxiety following natural disasters, and also decrease depressive symptoms following natural disasters. So our goal is to provide education to each family member on how to safely store hemophilia medications during power outages, how to create an escape plan at home, who to contact during natural disasters, and provide patients with emergency supply kits. And our emergency supply kits will include solar panel refrigerators, a small cooler, sanitizing Clorox wipes, a duffel bag, first aid kit, flashlight, and emergency action plan, just for a few things. Thank you.
All right. Thank you so much for that wonderful presentation and for all the amazing work you all are doing in Augusta, Georgia. Thank you as well to our lived experience expert, Chase. Thank you for sharing your perspective too. All right, now it's time for questions. Again, you can ask an audience question by hitting that question button at the bottom, Q&A at the bottom of your screen, and you can go ahead and send those in. Our first question, though, is for Chase. How has it been managing the emotional impact of the hurricane with your kids or yourself? Now that time has gone by.
Okay, this is a great question. So for the longest time, It was just time that kind of solved it, because for the longest time right after the hurricane, anytime it started blowing hard or it rained real hard, Jace was like, is another tree going to fall on the house? What's going to happen? Are we going to be okay? So this was something that we had to deal with for probably about 2 months afterwards. And it was just a lot of reassurance and just telling, like, look, I understand it was crazy. I wasn't home at the time that the tree actually fell on the house. I was actually at work. So it was something that Aaliyah, who's my fiance, had to deal with, the both of them by herself. So she could probably testify to this a little more than I could. But like I said, for about 2 months, anytime it rained hard or if the wind blew real hard, it was just are we going to be okay? Is another tree going to fall? What's going to happen to us? And it was just a lot of reassurance and time. And now he doesn't even think twice about it. So that's just something that we had to go through. And that's a really good question, because that's not something we really thought about at the time. It wasn't until about a week after, when the wind started blowing really hard, Jace immediately was like, hey, do we need to go hide? Like, is something going to fall on the house? And it was like, oh, snap. Like, I didn't realize that this really affected him the way that I thought it was going to. So.
Thank you. Thank you so much for answering that question. Thank you. All right, another question is for either Ms. Hawes or Ms. Smith. Many other HTCs and patients can benefit from this information. What are you doing or planning to do to share this incredible initiative?
So we're going to first start by doing work here at our HTC, and we do want to share this information with the entire bleeding disorder community.
Thank you. Thank you so much. Thank you all so much for sharing your stories and your impact today, especially thinking of the little ones and how this affects them in a totally different way. So I know it's a holistic approach we have to take to this, not just the medical, but mental health and all of that. Another question just came in. Were there any key learnings? Knowing what you know now, would you have done anything differently? And everyone on the panel can take a stab at this question if you would like.
You go first. Okay. Can you hear me?
Yes.
Okay. So, like I said, I'm a firefighter paramedic. There was another hurricane warning. This was probably several years before Helene, and it was supposed to hit Burke County really hard, which is where I work. It was just a really, really big rainstorm. So I didn't think anything of it. So when Helene came around, they said, oh, there's a hurricane coming. I didn't know until the day right before, when I was getting ready to go into work, that it was coming. Because Aaliyah was like, hey, do you think y'all are going to be busy because of the hurricane? And I was like, what hurricane? Because it's not something I really thought about. It's not something I've ever thought about. I'm 28 years old. I've never had a hurricane like Helene hit Augusta ever. So now, completely different perspective, right? Especially now that I saw how much it affected Jace and how we were displaced and everything like that. So we've actually set up our home to where we can run it off a generator, which we couldn't do before. Um, I would take it a lot more seriously, despite if it was something serious or not. Have a much more better approach to the next time this could possibly happen. Like, I'm just more cautious about next time. Like I said, we've set up our home to where it could be run on a generator. We have a backup power source now. We have like kerosene gas heaters and stuff like that we keep out in our shed, just in case if anything like this ever happens. Because not long after Helene, we all had an ice storm, and we only lost power for probably 2 hours, and then it was right back up. But it was just one of those things that we were already prepared for because of Helene.
This is Joetta. I'm going to piggyback off of Chase. Yes, so Merika and I was just discussing before the actual meeting started that since we have our expert parent here, so that he can also look at our list to tell us, since he is a firefighter also, so that he can tell us, some other things that may need to go into the emergency preparedness bag. The other thing is that getting our patients ready for, like Chase just mentioned, that when the newscasters say, hey, there's a hurricane coming, we need to prepare our patients right then by making phone calls and letting them know, hey, look, if you need to go and stay with a relative, go stay with a relative. Or either, like I said before, make sure that, you have some ice in a cooler, main thing, so that you can preserve the product. Just like what Chase was saying, it got to be like a challenge, when he had to take everything out of the box. So, getting other patients prepared for that time if it should come again.
Absolutely. Yes, preparedness is key. And I love that you all are incorporating the leads in this as well, because they have the firsthand experience of how to help community members in the future. And also to think about other parts of Georgia or the United States that haven't experienced hurricanes in over a decade. It may be time to get ready or to just be prepared. So thank you all so much for sharing this very helpful information. This has been an amazing presentation from both of you. Thank you for your time today. We're going to be getting ready to close out today's discussion. The recording will be available tomorrow on the bleeding.org website. So you can check this out and it will live there. And if you want to share it with anyone, we will have it for you. So thank you again for your time, Mrs. Hawes, Ms. Smith, and Mr. Williamson. Take care of those kiddos. And thank you so much for being here.